There we go.
We are recording the February installment of our lunch hour webinar series. Welcome. I'm so glad you could join us. We are coming to you today from, let me get this up. The community we serve actually operates on the traditional territories of the Erie Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas, on land covered by the Dish with One Spoon Wampum Belt Covenant and by the Between the Lakes Treaty of 1792. Today, we are discussing the future of income security, and we have an amazing lineup of people that I just found out. Some of them have never met each other before. Actually, I think all of them are new to each other. So this should be really interesting. We usually get people that, know each other and we get into our regular conversation. So hopefully this will generate something really interesting. Um, just to let you know, the format is going to be our guest speaker, Josh Smee, and then we'll move on to our panelists and get their opinions on what Josh had been talking about. And, hopefully it's generating some discussion. From what I know, none of them are shy people, so this should be good. Um, as well, I'm really uh, interested in hearing questions about strategy and what's going on in income security today. There is at the bottom of your screen, if you're joining us um, with the Zoom app, it's question and answer, Q&A at the bottom. When you place a question in there, all the panelists and guest speakers will see that as well. Of course, talk to each other in the chat. It's always important. As you heard, this is going to be recorded. So without further ado, um, you really don't want to be speaking to me. You want to hear from Josh. Um, Josh is from Newfoundland and he is from Food First, NL, Newfoundland. And he comes to us with a really interesting story about what's going on out there. So, Josh, please take it away.
Thanks, Laura, and thanks everybody for the invite. It is nice to meet some new folks on a call like this. Um, as Laura mentioned, I work with an organization called Food First NL. So we're actually a food systems organization. Our mandate is to advance the right to food in Newfoundland and Labrador, which obviously brings us into lots of contact with this conversation, because the biggest impediment to food security is income. And we know that there's no solution to food insecurity without working on income and income supports. And so we are quite active in our province as advocates and conveners around structural change to how we handle income security. And that's what I'm going to tell you about. I'll also say I'm actually originally from Ontario myself. I grew up in Kitchener. Sorry, Hamilton people. We do have a Hamiltonian on staff here as well. So Southern Ontario is well represented on our team at Food First NL. And it's quite fun to be invited back, at least virtually, to the old stomping ground. So what I thought that I would do with the next few minutes to set the stage for this conversation is give folks a sense of what's been happening in our province around income supports, and a little bit of a sense of maybe why that's been happening, what the political and organizing context is. I think it is interesting to see how different the direction has been in Newfoundland and Labrador, particularly in the last few years. Compared with Ontario or with most other jurisdictions in Canada. And there's a few reasons I think that's true, and happy to walk folks through it. So what I'll do first is kind of try and give you a sense of the current state of income assistance here in the province. Um, I'll leave it to the other panelists, Jennefer in particular, to talk about the sort of cross-Canadian comparisons in more detail. I'll say, in terms of rates, our province is right now kind of middle of the pack for in most cases, when you look at the spectrum across Canada. So, by no means does Newfoundland and Labrador have the highest income support rates, nor do we generally have the lowest, although folks with disabilities here are relatively well supported, and families are relatively poorly supported. And there's some big structural challenges built into the system. One thing I will flag, though, that I think is quite different from your context in Ontario is there is no requirement to be looking for work when you're attached to the income support system in Newfoundland and Labrador. And in fact, if you talk to people who run that system, as I often do about basic income, they say, well, income support in Newfoundland and Labrador is actually fairly close to an unconditional basic income. I think that's an exaggeration personally. Anyone who interacts with the system here knows that there's still a fair bit of surveillance that happens at the ground level of people's choices and their lifestyles in a way that is not consistent with basic income, but they are not looking for folks to prove that they're always pursuing employment. The other, I think, piece where there is some commonality between our system here and many others across the country is there are some poverty traps built into the way income support is built here, particularly that we have drug and dental plans that are only available if you're an income support recipient. So someone who's earning the same low amount in the workforce does not have access to these plans. And so for a lot of people on income support in this province, the financially sound decision is to stay on income support and not to move into the workforce, especially if you have any kind of complex medical need. And so that's an ongoing challenge. I think that's probably not a surprise to people who've looked into these questions, but that is a big part of what's happening here. One other, I think, important piece of context about Newfoundland and Labrador is that since really the 2010s, there has been a fair amount of work done on social assistance, on income supports, and on poverty reduction in general. So we had in the 2010s a quite successful poverty reduction strategy that was in fact led by a progressive conservative government here. And that's something I'd like to highlight because obviously you folks are in Ontario, you have a PC government there. Our political contexts are very different. But I'll say one interesting dynamic of Newfoundland and Labrador is that our PC party really feels like they own poverty reduction as an issue, that it's one of their signature accomplishments, and they're not wrong. So I look at this from like a food insecurity perspective primarily, and this is the only province in recent history since we started getting good data on this where you can see a decline in food insecurity. And it was during the peak years of that very focused poverty reduction strategy. And so if you talk to folks who study the interactions between income and food insecurity in particular, Newfoundland and Labrador is kind of the test case for the fact that interventions on income really can move that needle at the kind of population level. That said, that strategy really had its peak in the mid 2010s. We had changes of government. We had some real shifts of priority. For a long time, it really did feel like poverty reduction and attention to the income security system here had fallen off the radar. And that really only started to change in the last few years. And it was driven by a couple of things. One was a process called the Health Accord. So one other thing you can know about Newfoundland and Labrador is our health system and our health outcomes are a garbage fire. They're worse than anywhere else in the country. So we have the highest per capita health cost and the worst outcomes of any province. It's not a sustainable thing by any means in any way. And so a few years ago, a very broad-based process began to reimagine what healthcare in the province would look like. Or rather, I should say, and I make this mistake all the time, it wasn't about healthcare, it was about health. How do we move those bigger health indicators? And when you make the conversation about how do we improve health, you end up with a report that's actually mostly not about the healthcare system at all. You end up with a process that provides some really strong recommendations around the social determinants of health and particularly around income, and recognizing that there's just no way to fix the kind of hole that we're in from a healthcare perspective without fixing incomes. And so we had this report come out. It was guided by a group that was sort of the healthcare stakeholders across the board. So the Deputy Minister of Health, the CEOs of the health authorities, the heads of the healthcare unions, but also some representation from outside. I was on that panel actually as a community representative. And what we got was a report which is meant to set government policy for the next 10 years. And one of the core recommendations, and I'll quote it here because I think it's valuable to hear this, is ensure that Newfoundlanders and Labradorians have a livable and predictable basic income to support their health and well-being, integrated with provincial programming to improve food security and housing security. So that is really was moved into the column of like kind of core health policy. And I think when we look at this as a conversation with our provincial governments, where do provincial governments spend their money and where do they spend their time? It's on health, right? It's by far the majority of provincial expenditures. And so I think it was really telling to see the conversation around income security move into the conversation around health and healthcare. The next thing we saw happen, I think building on that in some ways here, was that our province did release an updated poverty reduction plan. It's not as comprehensive as the 2010s era poverty reduction strategy, which was really kind of metric driven and reporting driven. But this one does have a number of changes to the way that income support is managed here. For example, there was a pilot program a few community agencies were working on that incentivizes attachment to the workforce or people receiving income support. So you get to keep more of your money when you go back to work. You actually get a little bit of a bonus on your income support payments for maintaining employment, a few other things. That had been piloted in a small group of people, and it was expanded to all income support recipients. There's also been a lot of streamlining of benefits. So anyone who's on this call who is on social assistance in Ontario, I'm sure you know, these systems are really opaque and have so many different little substructures. And so one of the big efforts here has been to reduce just the number of rates. I think when the poverty reduction plan was launched, there was something like 30-ish different income support rates you could be receiving, depending on like your household structure, whether you live by yourself, whether you lived with family, all these different things. And there were some really weird kind of inconsistencies in there where people were losing money where they shouldn't be. And so the biggest thing that's been happening over the last year is things like tightening that up, streamlining that, looking for those places where there were kind of backwards incentives. They're allowing people to have more liquid assets. So like, I'm sure anyone who's on income support, again, on this call knows one of the real challenges is that you're only allowed to have a very small amount of money in your bank account before that starts reducing your monthly payments, which is very counterproductive for life stability. So, that asset, the liquid asset level, they call it, they doubled that here. There's been a number of other small tweaks within the system that have really, for most people, effectively raised their rates. And that's an ongoing process. It's also, I think, as a community advocate, it's a process that's really hard to keep good track of because the system is so opaque. So, we rely on touch points with the civil servants running the system to get a sense of, what the overall impact of this is. But their estimate was that it would be really significant for many income support recipients, especially for singles, actually, which are often kind of neglected in this whole business. We've also seen a couple of interesting developments in what they're calling, and we can talk about that, but basic income pilots in the province. So the language of basic income is very popular. And I'll say in Atlantic Canada, basic income is extremely well supported by the public, even more than the rest of the country. So if you poll people across Canada, it's probably 70-ish% of people are supportive of basic income. Out here, it's between 80 and 90, depending on how you poll on it, right? And so I think our government has recognized that. And recently, a number of new programs have launched that are pitched as basic income pilots. So we have one for youth exiting care, who are provided with a basic income for the first few years coming out of being in the care of the state. The other one is a pilot for seniors, particularly, it's actually a small group of seniors, ones who have like some additional medical needs, where when you turn 60, you receive this program and your income is bumped up to where it's going to be when you're 65. Because we know like poverty rates and or like negative outcomes decline a lot once people turn 65 and they access, what is effectively a basic income anyways in this country, right? So we have that pilot. And then the biggest one that's coming down the pipe here is when the Canada Disability Benefit comes into place at the end of June, early July. If anyone's been involved in that movement, it's a really disappointing level. It's $200 a month. But here, the provincial government is stacking an additional $400 on top of it for all those recipients. And so $600 a month is not nothing. And for the lowest income folks with disabilities, that's going to be almost a 50% increase in their income overnight. And so we do expect, I know I look at this from a food insecurity lens, and folks with disabilities are also very often food insecure, right?
Yeah.
I think we will see a fairly significant impact on our population level food insecurity from that. So that's what's happening. It's actually quite a bit. What isn't happening are some of the bigger picture shifts that advocates are still pushing for. So one that we have been really focusing on and have not gotten is indexing income support rates back to inflation. So one of the marks of success during the poverty reduction strategy here a few years ago was that for a while they were indexed to inflation. So your rates would at least go up by CPI every year. And that was quietly undone. It was never announced, it just stopped. And it's been a fight to get it back. So, and yes, thanks, Laura. I'm going to wrap it up now. I'll just last few points I'd want to make is just about like what's the difference in Newfoundland and Labrador, and I'll tee that up maybe for the other folks. We do have more cross-party consensus on this kind of thing. There's not a lot of daylight between the PCs, the Liberals, and the NDP around social policy here, and there really is not the same kind of toxicity that I pick up paying attention to politics in other provinces, and I think we've seen that. There's a general consensus that the government needs to be involved in supporting people in a way that cuts across parties quite a bit. We have leaders in the civil service here also who do really get it and have stuck around. They've been around for decades, some of them through many governments, and they've have their own relationships with civil society. I think that's been really important. And our government, for good or for ill, is often very responsive. So for example, when Food Banks Canada released their poverty report card last year and gave the government like a D minus on this, I know for sure that motivated some action internally. They do not love getting bad grades on this kind of stuff. And that's, I think, really also the function of a small province. There's a bit more responsiveness there. Thanks to COVID, too, there are more tables where government and civil society groups like ours are just at the same table, and we can directly say, here's how folks on social assistance are experiencing the current environment. A lot of the kind of COVID response tables have stuck around and become permanent. And so we have more touch points now than we ever did. We've gotten really good allyship from national organizations who are willing to sign off on policy submissions and things that our organization, others local folks here make. And I think there's our government likes to be seen as a leader on this, which is an interesting thing. And I think that's something maybe I'll close with is just, how do we get to this point where governments see this as something they compete with each other on, as being the one who offers the best set of supports to folks who require support with income. And I think our government does see it that way, and we've tried to frame it that way to them whenever we can as community advocates, is to put them up and platform them when they do the right thing, and then sass them when they do the wrong thing. And so that's, I think, part of what's gotten us to where we are today. So I'll stop there. I'll pass over to the other panelists. Thanks. I hope that's an instructive little example from Far East.
That was incredible, and there's so much to unpack there, and I'm pretty sure the other panelists are sort of chomping at the bit to sort of jump in there. I do want to say uh, the example you give is phenomenal. The politics around it, I hope we dive into. Um, but some of the things we're not some of it, all of it, I think we're hoping to do here in Ontario. I mean, we started back with social assistance reform when we did the income security report, talking about making the system less opaque, collapsing the rate so it's just one rate. It doesn't matter who you live with, and et cetera, et cetera. So this should be a really interesting discussion. Thank you so much. So our panelists that I mentioned. We have Sara Mayo from a social planner from SPRC Hamilton. Her claim to fame recently is Indecent Social Assistance in Hamilton and Ontario. Great report. I hope she'll refer to throughout the webinar. And of course, Jennefer Laidley, old friend from Isaac and currently a Maytree Fellow and the author of Welfare in Canada. So, what I'm going to do is get Sara, if you want, just respond to what you heard in a general way. Um, what are your thoughts on hearing Josh right now?
Um, the beginning in terms of income being the most important determinant of food security, it reminded me of a of speaking to an OW manager, and that person said that the low Ontario Works rates are the biggest impediment to leaving assistance. That low income, and the way Joshua talked about poverty traps, that the way that Ontario's excuse for low Ontario Works rates is, oh, this is just a short-term program, so people aren't on it long. Um, and and certainly people are on Ontario Works less than ODSP, because many people on Ontario Works become disabled and have to change to on the ODSP due to the harm and harsh conditions that they endure while on while on Ontario Works. So those links that we're not making enough links, I think, between the problems we have in society food around food security, certainly in Ontario around encampments and homelessness and mental health issues, and Ontario Works rates. For example, I was very disappointed that the Association of Municipalities of Ontario, which has some very progressive councillors that are part of it, uh, they had a huge report about thousands and thousands of people in Ontario experiencing homelessness, and they did not talk about on social assistance. Like, what is causing rise in homelessness? Obviously, it's the decrease in social assist the decrease in value in social assistance that we've seen over the years, and that they didn't mention it. I think is a real shame, and we have to push as community advocates to really make those links more clear. I love the idea of the report card and the way you said that, that really kind of, they don't like being embarrassed, and report cards are good because it's just like a headline, people read much more the headlines than the stories. And so, like, are there ways that we can think as advocates of ways of putting in a headline, uh, creating a headline, not creating like a long report, but like what kind of headlines can we create around these important issues?
Fabulous.
It,
Thank you so much. Sorry, did you have more, Sara? I
well,
don't
I
want to
just
cut you
wondered,
off.
just in terms of, do you want me to mention my chart now or later? It's up to
You
you.
can,
Or do you
why
want
don't
me?
you do it now? And I think we'll
Okay.
get Jennefer to jump in after that.
Okay. So I just wanted to show, so I'm in the chat, I'm adding the link to our report, which is an interactive report. And so it has this chart in it, and it's interactive. So you can put your mouse, or on a touch screen, you can do every single year and see the amounts if you're interested. And this chart, I think, is just so important for us to visualize and think about how low can Ontario go for its social assistance rates for Ontario Works. This is only Ontario Works basic shelter and basic needs and shelter amounts. So it doesn't include Trillium benefits, HST benefits. So that's another $70 a month for around that, but for Ontario Works recipients. But essentially, this is the base income, about 90% of the income of a person on social assistance in Ontario. And so we see that in 1996, when things were when we had huge cuts from Icaris and made huge headlines and was a huge controversy in our province at that time. We're $200 lower than we were then, and there's no headlines about it, because it's been just slow and steady and not one big cut, and the cuts have come from not being tied to inflation, and now, I think we see even more starkly now that ODSP has now been tied to inflation. We see that increasing. It's only increasing in value because of the inflation adjustment of the other numbers, but essentially it is keeping up with our cost of living. Obviously the base amount is too low to begin with, but at least it's not losing value. But Ontario Works is not pegged to inflation, and so it is losing values every year. The value of 733 is last year, and it will, unless there's a change, continue to be 733 this year, which is a $14 reduction in value, just at our very low 1.9% inflation. So essentially, we are driving Ontario Works rates towards zero, and we're also, that gap between Ontario Works rates and ODSP is just getting bigger, which makes it just so unfair and demeaning to people who don't have a disability, to just say that their lives are so are not valued in any way by our society is a huge problem.
Definitely. It's undignified. It is
Mhm.
inhumane, indecent, as your report is titled. Um, there,
And so our call, along with obviously all advocates in Ontario, is to double Ontario Works and ODSP rates, not just ODSP rates, as some have called for. Ontario Works rates absolutely need to be doubled, and in an election campaign where they're talking about building a tunnel under the 401, which would be like, thousands of times more expensive than social assistance increases. It's outrageous that we can't consider um, what we need to help so many other issues in our society, not
well,
just individuals.
it's more than outrageous. I mean, if um, you look at $733 for an entire month and people aren't getting jobs, what is the assumption that it's easy to live on $733 in this province? Is it like, what's the rationale behind it? Because it's not happening. There's no increase in employment. The welfare rolls have not dropped dramatically since 2018 by freezing the rate. Sorry, I'm going to get off my high horse and I'm going to let Jennefer Laidley in on this conversation. Um, Jennefer, hello. I'm so glad you're with us today. You're muted still. Um,
Thank you. Sorry about that. Good to
it's
see you.
okay. Good to see you too. We haven't had a chance to chat in a long time, so I'm looking forward to what you have to say on this, partially with what Josh is talking about and also your own research.
Sure. So, oh boy, there's a lot bouncing around in my head, so I'm thinking about where to start. Your question to Sara, or your speculation about why government thinks that $733 is sufficient to live on. I mean, I think that gets to the heart of what Josh was talking about around different political cultures. You and I chatted about this a little bit last week, but there was a recent piece in, I think, a paper or an online publication called The Trillium, where Doug Ford was talking about, the piece was all about the promises that the political parties in Ontario have made during this election campaign on income assistance. And it said that the Liberals and the NDP and the Greens have committed to doubling ODSP rates. The NDP and the Greens have committed to doubling OW rates. But when asked, Doug Ford said, firstly, no, he's not going to double ODSP rates. He wants to create the climate for more jobs, create more income, increase the government coffers so that we can take care of people on ODSP. And when asked if what that meant was if the economy improves under his watch, whether he would then double ODSP rates, and he didn't have an answer for that. And in terms of OW, he said that there was widespread fraud among people on OW, that there are, mostly healthy young people sitting on the couch watching the Flintstones. I mean, this is Mike Harris era language, right? He said there's probably 300,000 or 400,000 people on OW who are sitting at home collecting your hard-earned dollars. So, the language of pitting hard-working working people against folks on social assistance is very much prevalent in his discourse around income security. So a very different understanding of the government's responsibility and the state's role in ensuring people can, feed themselves and have housing and, a decent place to live. So how do you, I don't want to leap directly to the big question, which is how do you respond to that and how do you deal with that? And I think that we can have a conversation among the four of us about that in a minute. I did want to show a couple of graphs, if that's okay. Let me just move stuff around here. I got too many tabs open. There we go, share screen. So I'm going to share this one. Just wanted to share with people a little bit of info from the Welfare in Canada report. So if you go to the Maytree, I've been working with Maytree for the past 6 years. I think this will be the 6th year that I've been doing the Welfare in Canada report. And when you go to the Maytree website, this is an organization in Toronto that picked up responsibility for calculating total welfare incomes across the country back in, I think it was 2018. I think I started in 2019. But we've got a 40-year data series, so we can go back and compare back to 1986 when the National Council of Welfare started doing calculations of total welfare incomes. When you go to the Maytree website, this is what you see. And if you go into Changing Systems and click on Welfare in Canada, you'll get to the report. And I'm just going to make it a little bit bigger so that folks can see it well. And as you can see here from the
Jennefer,
sorry to interrupt you, Jennefer. I think we're seeing
Sure.
Your secondary screen, not the one that you're talking about.
Okay, let me stop sharing that and find the right one.
I don't want to miss it.
That's okay, thank you. Let me see, how about that one? Does that work?
Perfect.
Great. So let me go back. So you go to the Maytree website and you go to Changing Systems and click on Welfare in Canada under Data and Measuring, and that's what you get. And the report navigation is all on the right-hand side here, and you can take a look at total welfare incomes by location, so you can see whichever province or territory you want to see. There's also a number of key features of social assistance, which has information about whether or not benefits are indexed to inflation, what the asset limits are for eligibility for assistance, what the earned and unearned income exemptions levels are, and another couple of things like structure of basic benefits. But anyway, I wanted to show you Ontario. So here's the Ontario page, and the navigation is right here. What we do is we, for 4 different household types, and that methodology was established back in 1986, we look at a single considered employable, we look at a single person with disability, we look at a single parent with 1 child, and we look at a couple with 2 children. And we have a peek at the components of welfare income. So I do a lot of math every year. We look at the components of income from the various sources, so basic assistance, additional assistance, child benefits, and then the various tax credits that might be available to low-income people. And in the Ontario case, that's what this looks like. And then we go on to looking at changes in welfare incomes over time. So this is very similar to that graph that Sara showed, only the difference is hers was only social assistance rates. This has all of the other pieces of total income. I mean, we make the assumption. Sorry, I just had to turn off my heater. We make the assumption that folks have done their income taxes in the previous year, so they're eligible for tax delivered benefits and credits. But this is the total suite of possible income sources that a person receiving social assistance could get. And the red line is for the single considered employable, and the orange is for a single with a disability. So a very similar shape to the graph that you saw earlier from Sara. And this is for households with children. But looking just at the dollar figures, it tells us something, but it doesn't give us the whole picture. So we also do a bunch of analyses. One is around adequacy. And these graphs I really like. Let me just make that a little bit easier to see. So the red is for the single considered employable, and the orange is for the single with a disability. This top line here is the market basket measure, the black line, which is the official poverty line in Canada. And the gray line here is deep income poverty. So that's 75% of the poverty line. And the market basket measure changes depending on where you live. So we use the market basket measure for the largest city in each of the provinces and territories. So this is for Toronto. And you'll see that, so the total, this is for 2023 as well. We're just started working on the 2024 report. So you'll see that the unattached single considered employable had an income of total welfare income, rates and everything else of just $10,473 in 2023, which is pretty far away from the poverty line of 28,766. And I've got I think it's 36%. Let me just look at what I've got. Sorry about this. Right, 30, I just want to check my notes. Yeah, so singles, for the unattached single, that's 36% of the poverty line, which is extraordinarily low. I mean, living under 75% of the poverty line is extraordinarily low, but 36% is embarrassing. And well, we could use a lot of adjectives to describe what that looks like. And of course, we can make a lot of assumptions, and a lot of assumptions based on research, as Josh was talking about, that these folks are having all kinds of health impacts, and those health impacts affect not only them but also their families if they have families, but also costs of healthcare in the province. And general well-being issues for the larger population. So the unattached single with a disability is at about 59% of the poverty line in 2023. You'll note that the market basket measure is the same for these two singles. So one of the issues here is that the market basket measure doesn't take into account disability when thinking about what the poverty line should be for people with disabilities. So we could probably assume that their poverty is worse if the MBM would be higher if it took disability into account. And then we have a quick look, just really quick, at households with children. So this is the single parent, one child, and they're at about 59% of the poverty line, and the couple with two children are at about 60% of the poverty line. So what we can see there is that in 2023, everybody was living in deep poverty. All of four of these households that we look at were living in deep poverty in 2023, which, if you're giving a government a report card for how well they're doing supporting people, you might give them a pretty failing grade. And just one more thing, and that was changes to adequacy. So this is a complicated graph, but what it shows is the relationship of total welfare incomes for, in the red, singles considered employable, and in the orange, single with a disability, the relationship of their total incomes to the poverty line over time. So this goes back to 2002 when the market basket measure started. And you can see that the unattached single considered employable, and the up and down lines are breaks in the data series because we can't make direct comparisons after they've done what they call a rebasing of the market basket measure, which is they change the basket basically, and they change some of the way that they calculate the market basket measure. So it's not a direct comparison. But anyway, we can see that unattached singles considered employable were well under the deep income poverty line, which is again this gray line, for the entire period from 2002 to 2023. That the unattached single with a disability was a bit above deep poverty, but then went below deep poverty. There's a bit of an uptake in the last year between 2022 and 2023, which is due to the investment that was made in those years. And then something similar for households with children. Again, both of these households were under deep income poverty for the entire time series. So again, folks who are wanting to, perhaps do a report card could use this data and information to help do that. I also just wanted to quickly show Newfoundland and Labrador because our friend Josh has been talking about that. Now there's a bit of methodological issues here in this big dip and then this big increase. That's due to ways in which we calculated total welfare incomes in those periods. But these are just the raw numbers. But in 2023, you can see that adequacy was a little bit better in Newfoundland and Labrador. As Josh said, they're about middle of the pack. So for singles, they're about, so singles on OW in Ontario is about 9th out of 12 jurisdictions, not including Quebec, and I'll talk about Quebec in a minute if that's okay. But Newfoundland is 5th in terms of adequacy. For singles with a disability, Newfoundland is 4th compared to Ontario, which is 10th out of the 15 programs that we look at. For single parents with one child, Newfoundland and Labrador is 7th out of 13, whereas Ontario is 11th out of 13 in terms of adequacy. And for the couple with 2 kids, Newfoundland is doing better again than Ontario, so 8th out of 12, as opposed to Ontario's 10th out of 12. And you might wonder who's doing the worst. Nova Scotia and New Brunswick are doing the worst, although Ontario hovers at about that level. So not doing much better than the worst provinces in terms of adequacy. So maybe I'll just say a couple of words about who's doing other things. Who across the country is taking different approaches. Well, PEI is a really good example of a province that's made significant investments in incomes, and you'll see that in the graphs. Now just scroll down here. Whoa, that's a different graph. You can see that starting in 2018, this is just the raw numbers, the total income numbers, that between 2018 and 2023, incomes increased significantly for both of those unattached, and incomes have been increasing for households with children. And adequacy is much better in Prince Edward Island. Still, for the unattached single, still below deep income poverty, but they're making progress. And the same for households with children, who are both above the deep income poverty line. Now, I just want to say, shooting for the poverty line is a pretty low bar. Of course, we need to take that into account, but we do need to look at the realities of whether or not provinces are doing a little bit better than others. I'm just going to stop sharing that and say a couple other things about what some other provinces are doing. I wanted to mention Quebec in part, in no small part, because they have, in the last couple of years, put together some programs for people who are new entrants to social assistance that provide significantly higher incomes for people who are just entering social assistance. they're being given basically the same level of income as you would get on workers' compensation or in training programs. And so it's kind of like the opposite of work requirements. So when you enter into that program, you're given you have work requirements. You're supposed to be taking some certain kinds of training or doing certain kinds of work, but they give you a significantly larger amount of money for doing those things. Rather than in the Ontario case where if you don't undertake work-related activity, you don't even get the $733. So they're really financially incentivizing work-related activity, and they are doing this in large part because there's research that shows that if you are newly on social assistance, the longer you stay on social assistance, the worse your health outcomes will be, and the harder it will be for you to get back into the labor market or into the labor market in the first place. And so they're wanting to get people as they're, initially on social assistance, getting them engaged in the labor market. One of the difficulties is that the program only lasts for a year, but although you can get a 1-year extension, and they're not really investing very much other than indexing in benefits in the regular program. So after you're on this program, this initial program, if you are staying on social assistance in Quebec, you would go back down to the relatively low levels of income support that are available in the regular program. So that's a lot of things that I've talked about in terms of kind of facts and graphs and data. I want to get back, I think, into the discussion about political culture and different understandings of
That's where we're going with
how to
it.
make change. So let me throw that back to you then, Laura.
Yeah, we have about 10 minutes more for panelist discussion. I just did a disability or disabling reply to a question about, health and poverty, kind of a bailiwick that is really important to me. It can be disabling in terms of mental health as well, but we know welfare diets that are high in carbohydrates, there's more than a 30% increase, depending on the study you look at. It could be even more, actually, that people with low incomes, because they're making up their diet with a large amount of carbs to feel fulfilled, because they're not using meats and fruits and vegetables because they're so expensive. They are aging faster in terms of cardiovascular disease. There's so many problems with it. There is a question if someone like to just type it in, because I do want to get to the climate, the political climate, and what do we need to do to change that climate? Is it evidence, etc.? So I'm going to go as succinctly as possible, say under 2 minutes, go through Josh, Sara, and Jennefer to talk about what they think is the strategy. What do we need to do to change the mindset? Because we know it needs to change. I don't think anyone on this call thinks it doesn't need to change. And the Q&A box is asking about climate change and poverty as well, if someone wants to tackle that just in the chat box. Thank you.
Yeah, just really quickly, I think one thing that we've seen fairly effective on this, or at least a part of the puzzle, is for community organizations who don't have the word like poverty in their name to engage on this and engage on this as allies with each other. I think so we have a pretty strong basic income alliance here, for example, made up of community organizations, because they all ask themselves, what would be the one sort of social policy change that would reduce the need for our services the most, right? And so I think you can extend that. Lots of people have interest in social assistance or income assistance rates going up, right? Like food security groups do, mental health groups do, youth serving agencies, like really the whole gamut of sort of ground level community service agencies across the province And I think there is some value in building coalitions between those groups so that the argument around this is not always coming from an organization that's specifically mandated around poverty, but that it is one that's saying, like, here is how poverty affects all these things. That's been reasonably effective here. But in Newfoundland, we also don't really have an anti-poverty advocacy group, so that's a gap. So I think there needs to be both. But that's the point I would highlight, I think.
Yeah, I would echo that. I mean, I think that I did advocacy work in Ontario for 12 years with the Income Security Advocacy Center, and the most progress that we made, I mean, that was under a liberal government, so it's a bit different as well. But the best progress that we made, I think, was when we worked in coalition with other organizations. And particularly, I mean, I think I want to pick up on what you were talking about earlier, Josh, in terms of health impacts. I mean, I think that partnering with health-related organizations, doctors, we had some fairly good results when we partnered with doctors around ODSP, disability definition, and applications. So working in coalition with unusual suspects, I think, is a great recommendation, particularly those who are connected to government. You know, if you can identify the organizations that government listens to and talk with them about how poverty impacts them and how working together on this issue will be better for everyone, I think that's a good approach. Also, what you were saying, Josh, around the tables that you're involved with government. I left Ontario in 2019, and forgive me if I'm getting I think it was 2018 that the Ford government, thanks for the nodding head, Laura.
Yep.
So the Ford government took over in 2018, and we found that they really didn't want to talk to us. I mean, I think that that's indicative of, and us being sort of, the broader anti-poverty movement in Ontario. So it went from being able to call the minister's office to never getting a call back. So if there are ways but now that they've been in government for quite a long time, I mean, it's a different situation now, given that there's an election on, and we'll see what the outcome of that is. But working with government on, in a cross-partisan way, but also in a community-based way where, where you can participate in at least providing them with information and advice on policy is really important. So making representation to them to set up tables like that, I think, is helpful. Besides the usual, like vote and organize and talk to folks in community. And, it has to be a very broad, multifaceted strategy that involves everyone in community, but also actually talking to government. So.
Thank you. Yeah, it's definitely something different I want to tap into. Sara, please.
And expanding from that, I think in this moment of trade uncertainty, economic uncertainty that is happening and that may increase tremendously due to the US situation, I think we can, I think we can use that to further amplify our demands, to say we're in a period where we have to protect Ontarians. We have to protect the most vulnerable from these terrible tariffs or whatever is going to happen. And so to talk about how there's going to be more people we saw in the recession in 2010, a big increase in social assistance. So there's going to be even more people on social assistance. So we have to make it a program that helps people through that transition in our economy and doesn't ground them further to the ground where they're not given. It's a ticket. In our report, we talk about it as a ticket to insecurity instead of a ticket to opportunity. And so basically, to use the current moment to say we need a strong social assistance system more than ever because of the economic uncertainty, because more and more people are going to need it.
Thank you for that. And we did cover Josh as well, did we not? Yeah, you had started this one. So I'm going to wrap up with a thought. And thank you, Sara, for that amazing segue, because this is what I wanted to wrap up with these trade announcements, this trade war, which is we'll be fighting for at least 4 years. There is a role for the feds, even though this is about Ontario. Um, During the pandemic, the province was not adverse to CERB. And we've already had, a liberal leadership contender talking about possibly reinstating a CERB type program to deal with the trade war. And I think we can use that to help build a coalition. I think it's a perfect time as well to start talking about what the point of EI is at this point. If most of the lowest income workers, multiple job workers in Ontario can no longer access the program because they don't have enough hours in a single job, never get to collect, and yet it's mandatory to pay out. I think all these conversations are a great way to build strategy as well, provincially and up through the feds. Um, but I think there is work to do here. I think ensuring that it's a nonpartisan approach to all of this. And I just want to thank everyone that's been speaking today. I mean, I wish we had 3 hours because you're all so intelligent and you have so much to give in terms of teaching us what can be done and what we should be doing and what the impacts are of failing to do that. There's sobering stats provincially and locally. Um, I I loved hearing from you. This is so important. We will be posting this online. We will have the chat recorded. And last but not least, next month, we will be dealing with childcare and what the situation is locally and provincially, how it's rolled out. Is it working in Ontario, the federal program? Um, yeah, some great advocates will be discussing this. So that will be March 18th, next month at noon. Please feel free to sign up if you can. Um, and yeah, thank you. It's been a fantastic conversation. Take care.